Morning. To talk about how you can stay healthy before, during, and after the storm is Dr. Jane Morgan, Executive Director at Piedmont Health at Piedmont Healthcare. Thanks for joining us. So we tell people you got to prepare, getting the batteries and the food, but also people have to prepare for their health during this whole journey. Talk about how people can do that.
That's right. We know that within the first 2 weeks of a hurricane and other natural disasters as well, but specifically hurricanes, that the rate of heart attacks increases, actually doubles in those first 2 weeks. And what people don't often consider if you decide to shelter in place is the stress of the anticipation of the event that's coming. After you've boarded your house, after you've sandbagged, after you have your provisions in place, then there's this waiting. And the stress of that, especially for people who already have heart disease, already have had a stroke, that can actually be fatal for some people. And then what people don't think about is the aftermath. After the hurricane has blown through, what is it going to take for you to survive there with infrastructure destroyed, pharmacies not available, emergency services not able to reach you? Even how are you going to access fresh food and water? You may have to do a lot more walking. You may have to dig. You may have to use a shovel that you haven't used in a long time to dig out of things. The physical work and exertion of surviving in an aftermath after a hurricane, people don't really think about that, and you may have to survive for 1 or 2 or 3 weeks as the Red Cross comes in and other services.
Let's say that you're in a home that wasn't, terribly damaged infrastructure-wise. Maybe your power's just out, or you don't have clean water. You have to boil your water. People have their routines and exercise routines and eating healthy, but a hurricane can really disrupt that. So how can people kind of manage that in those weeks afterwards when you have a natural disaster?
And that's such a good question, Molly, because one of the things that we think about are medications and prescription medications. Not only do you have enough to ride out the hurricane, do you have enough to ride it out for 2 or 3 weeks? So have you gotten additional supplies? And many pharmacies will allot additional supplies for that. Additionally, what are you doing with regard to, do you have CPR training? Do you have an AED available for defibrillation with a battery backup? And then the other things to think about are chronic medical conditions. Excuse me, diabetes, high blood pressure, both are big risk factors for heart disease and stroke. Many people suffer from these, and we need medications and food that helps to control those disease processes as well. And so people have to begin to think about the entire compilation of what it's going to take to actually survive not only the anticipation of the hurricane, but as you say, your structure is intact, but the infrastructure around you may not be. Even though you may have electricity, you may have water that you are boiling. There will be other things that you will have to manage, including the stress, the mental stress of loss of property, loss of pets, loss of belongings, loss even of life of people that meaningful to you in your neighborhood and in your family. All of those things, you have to be prepared for. All of those create stress on the heart.
We have about 30 seconds left, Doctor. So how can people work towards reducing that risk of stress during these times?
So if you're asked to evacuate, do so. Think about it even with regard to, oh, I've lived here for years, I've never evacuated, I know how to board up my house. I think we were talking before we started about age. Age is never your friend. And even though you've lived there for 30 years, your body has changed in those 30 years. You've ridden out a lot of hurricanes, but now you're 70. So let's think about the difference between riding out a hurricane at 70 and riding out a hurricane when you are 30, and what that is going to take and what that is going to mean.
All right. Great information. Thank you so much for your time and information.
Thank you.
Dr. Jane Morgan, Director of Health at Piedmont Healthcare. Thanks for joining us.
Thank you.